Erythrocyte Sedimentation Rate, ESR. In the world of medicine, there are numerous tests and procedures used to diagnose and monitor various health conditions. One such test that you may have heard of is the Erythrocyte Sedimentation Rate, ESR. Despite its complex-sounding name, ESR is a straightforward and valuable tool that healthcare professionals use to gain insights into your health. What are erythrocyte sedimentation rate, ESR? Erythrocyte sedimentation rate, often abbreviated as ESR, is a blood test that measures the rate at which red blood cells, erythrocytes, settle at the bottom of a test tube or similar container over a specified period. To put it simply, it measures how quickly red blood cells in a sample of your blood fall to the bottom of a tube. Why erythrocyte sedimentation rate, ESR? You might wonder why healthcare professionals perform this seemingly basic test. The ESR test is not only easy to conduct but also provides valuable information about your health. It is typically used as a nonspecific marker of inflammation. Inflammation is your body's natural response to various conditions, including infections, autoimmune diseases, and some types of cancer. When inflammation is present, certain proteins in your blood increase, causing your red blood cells to clump together and settle faster, leading to an elevated ESR. Common erythrocyte sedimentation rate, ESR. The normal ESR values can vary depending on your age and sex, but in general. 1. For men under 50 years of age, the normal range is usually 0 to 15 mm per hour, per hour. 2. For women under 50 years of age, the normal range is typically 0 to 20 mm per hour. 3. These values can be slightly higher for individuals over 50. Keep in mind that what is normal for one person might not be the same for another. Individual differences can exist, and your healthcare provider will consider your specific circumstances when interpreting your ESR results. Interpreting erythrocyte sedimentation rate, ESR, results. Understanding your ESR results can help your healthcare provider in several ways. Assessing inflammation. An elevated ESR can be a sign of inflammation in your body. It doesn't pinpoint the exact cause, but it alerts healthcare professionals to investigate further. Monitoring disease activity. For individuals with certain chronic diseases like rheumatoid arthritis or lupus, ESR can be used to monitor disease activity. An increase in ESR may indicate a flare-up. Evaluating response to treatment. If you are receiving treatment for a condition associated with inflammation, regular ESR tests can help gauge how well the treatment is working. A decreasing ESR over time may indicate that your treatment plan is effective. Ruling out other conditions. In some cases, a normal ESR result can help exclude certain conditions, although it doesn't definitively rule out all health issues. How the test is conducted. The ESR test is relatively simple and doesn't require any special preparation. Here's what you can expect during the process. Blood sample. A healthcare professional, usually a nurse or phlebotomist, will draw a small amount of blood from a vein in your arm using a sterile needle and syringe. You might feel a brief pinch or sting during the blood draw. Sample placement. The collected blood is then placed in a narrow, tall tube known as a Westergren tube. The tube is marked with measurements in millimeters. Waiting period. The Westergren tube is placed in an upright position and left undisturbed for a specified amount of time, typically 1 hour. During this time, the red blood cells settle to the bottom of the tube. Reading the results. After the waiting period, the healthcare provider measures the distance the red blood cells have fallen in millimeters. This measurement is your ESR result. For whom this test is for and what diseases this test is for. The ESR test can be ordered by healthcare providers for various reasons and is used in the evaluation of numerous health conditions, including but not limited to inflammatory conditions. ESR is commonly used to assess and monitor inflammatory conditions such as rheumatoid arthritis, lupus, and inflammatory bowel diseases like Crohn's disease and ulcerative colitis. Infections. It can be useful in detecting and monitoring infections, including bacterial, viral, and fungal infections. Certain cancers. Elevated ESR levels may be associated with some types of cancer, such as multiple myeloma and lymphoma. Temporal arteritis. ESR is often used in the diagnosis of temporal arteritis, a condition that causes inflammation of the blood vessels. Polymyalgia rheumatica. This condition, characterized by muscle pain and stiffness, often presents with an elevated ESR. Monitoring chronic diseases. Individuals with chronic conditions like diabetes or heart disease may have periodic ESR tests as part of their routine monitoring. In summary, The Erythrocyte Sedimentation Rate, ESR, test is a simple yet valuable tool that provides insights into your health, particularly in assessing inflammation and monitoring various conditions. If your healthcare provider recommends an ESR test for you, it's important to follow through as it can aid in diagnosing and managing your health effectively. Remember that ESR results should always be interpreted in conjunction with your medical history and other diagnostic tests to arrive at an accurate diagnosis and treatment plan. Your health matters for us. We are Quali.Health. If you want to effectively protect your health, get your all-access health pass at www.quali.health. Our health skills provide valuable information and guidance on specific health conditions.